Hello, everybody. Thanks for being with us. We'll just wait a few seconds, maybe 10 seconds or so, to allow others to join, because joining online in this technological age sometimes take a little longer than we all expected to. But just another few seconds, and then we can start going. All right, so let's begin. And again, thank you everybody for joining us. This is the third in our ongoing series of mental health care and primary care. And so important in this Mental Illness Awareness Week to keep discussing effective solutions that can address the need for rapid access to high quality mental health care in the community. You will remember our first session was with Senator Dr. Ravalia, a family physician from Newfoundland, and we talked about the importance of integrating mental health care into primary care, breaking down the silos and using primary care as its foundation for all health care. Then we had Dr. Hobson from British Columbia and Dr. Bagnall from Nova Scotia, coast to coast, talking about healthcare human resources development in primary healthcare, and how to apply different kinds of models of care in primary health care. And today it's a tremendous pleasure, both professionally and personally, because I know our next guest quite well, to invite Dr. David Gardner to talk about a really interesting area in primary care. And Dr. Gardner is a pharmacist. He is an academic pharmacist. He teaches at the Department of Psychiatry at Dalhousie University and the College of Pharmacy at Dalhousie University. And we're going to be talking about pharmacists' role in mental health in primary care as part of the wider community-based mental health care team. So, Dr. Gardner, it's a pleasure to have you here today. How are you doing?
I'm great. Good to see you, Senator Kuchar. Always a pleasure of mine, too.
Let's just say David and Stan, and then we'll be fine.
All right, then I won't trip over my words. I've been saying that for 30 years.
Yeah, it's sort of weird calling you Dr. Gardner. Anyway, David, you take it away. You had something you wanted to show us to start.
Yeah, we've got a video set up. So this is a video that is introducing people to something called the Bloom Program. And the Bloom Program has sort of a more formal name, which is a collaboration by community pharmacy and mental health across the province of Nova Scotia. So we developed this program quite a few years ago and introduced it through a study, and it was thought positively by government. And so now it's an actual program across the province that people can offer at their pharmacies, and they can roll patients into the program itself. So this video, we didn't actually make this video. We didn't even know about this video that it was going to happen, but the co-developer, Dr. Andrea Murphy, and I were invited to go sit down with some videographers who made the video, and they just asked us a whole bunch of questions over at the College of Pharmacy. And lo and behold, the 1 minute video shows up like 2 or 3 months later, and here it is. And we went, wow, that's fantastic. We didn't even ask for that. So the government of Nova Scotia created the video, and we use it to help people become aware of the Bloom Program.
All right, so let's have a chance to look at it and listen to it. How do we do this?
Pharmacists 10 times more often than they'll see their primary care provider.
But not everybody realizes what the pharmacist can do for them. So the Bloom Program is an initiative by pharmacists
to help with mental illness and addiction in our communities in Nova Scotia. Many people will avoid seeking care for mental health problems.
And you want to have somebody that you can go to and get questions addressed as quickly as possible.
We're able to really sit
in a private space
and discuss different issues.
To identify what your health needs are, what your medication issues are.
Medications are a critical part to recovery.
But half of the things pharmacists are doing are not directly related to medication management.
The biggest thing is support. Community pharmacists are there to listen. I feel great about the program.
I do too.
Yeah.
People come back saying, I'm so glad I have my pharmacist there. It's more than meds.
It's people, not pills. I'm Andrea Murphy.
And I'm David Gardner.
We're trying to help people get access to the mental health care that they need.
Wow, that's amazing. That's the first time I've seen that.
I was just going to ask that.
Yeah, and this is maybe a novel idea to some people. The pharmacist, a community healthcare provider, engaged in mental health care. Can you help us understand how that works and your thoughts about that?
Yeah, I hear that all the time, that it's novel, and I think of it from two perspectives. So there's the community, the people that live with mental illness and addictions, people that are supporting people in those circumstances, family members and friends and so forth. And then on the other side, there's the healthcare providers. And sometimes when I'm meeting with groups of individuals, so people who live with mental illness or their family members, some of them will say, I have never thought of a pharmacist that way. But other people in that group setting will say, oh my goodness, I've been working with a pharmacist for 10 years. And if it wasn't if I didn't have that pharmacist, the glue wouldn't be there in the healthcare system for me. So the pharmacist to that person is not acting as a medication manager only. Of course, that is their core responsibility, but they have hooked them up with care providers that they've never heard of. When they've been had some difficulties connecting with their physician to solve a problem that they have right there and then, sometimes it's difficult to get through. The pharmacist can get through and make adjustments to medications, or the pharmacist might say, this is not really a medication thing. I'm going to give you a phone number, or I'm going to set you up with somebody I know down the street, and why don't you give a call to them? And then the same thing happens with healthcare providers. Often when we have brainstorming sessions, there'll be a few healthcare providers that really have never really thought of their pharmacist beyond that dispensary medication counseling role, and others who say, I call my pharmacist to get recommendations all the time about this or that. So we're trying to, through the Bloom program, make the whole pharmacist come to life. Like, pharmacists have been doing this behind the scenes, and now we want to say, hey, there's medication management as a role, there's collaboration as a role, there's self-directed care as a support person, there's triage. If you're in dire straits, you might need triage, immediate triage, and so on and so forth. Just being there to be that friendly voice, that person that's totally directly accessible to encourage you, is something that pharmacists do, and nobody even knows about that, but they're doing it every day.
Yeah, when I first heard about this program, you were discussing it with me when you were and Dr. Murphy, Andrea, were conceptualizing it. It seemed to me such an obvious thing. I never even thought of it, but and thank you for bringing it forward. When I go to a pharmacy, I mean, I might go in, sometimes our pharmacies like grocery stores, I might go in for some milk, or I want to go in for some toothpaste, and sometimes I want to drop off a prescription for an antibiotic or something. But all of those are different ways that people can enter then, right?
Yeah. So
that's what happens then.
Well, I think of the pharmacy as, it's a healthcare center acting as a retail space. So why do you go to a pharmacy? Well, you got to get a birthday card or something along those lines. And then you go, oh, just a second, we were low on a certain medication that I like to have around the house. If you have a relation with the pharmacist there, you're going to look over and you're going to give them a wave, and you're going to say, hi, Melissa. And the pharmacist will say, hey, David. And Melissa might actually say, how has blah, blah, blah been going for you? And all of a sudden you say, let's go into that private counseling room, because it never even occurred to me that I should follow up with you. But just because you asked me that question, you've triggered me to think of 2 or 3 things to do with my child, to do with my partner, to do with my own health. You are right there. I don't have to look it up on Google. I don't have to call and wait for somebody to call me back. You're right there and available to me. If it's not busy, I don't even have to wait for you to chat with me. We'll go right into the private consultation area, and it's in that private consultation area you're going to feel comfortable sharing information with me, and I'm going to feel really comfortable sharing my private health information with you. Outside, it's more of a discussion where if somebody overhears it, maybe you'll feel okay about that. But the private consultation is the trick. Getting in there, and all of a sudden, everything is on the table. It's a great conversation.
Yeah, and it's interesting that it's that private space. It's a sanctum where you can actually talk about things. And confidence, because I think that's so important. People also sometimes forget that pharmacists, as healthcare providers, have confidentiality, and that's an issue. And what kind of training do pharmacists can they get to sort of make them more effective, and as they sit with somebody and the person unburdens themselves about an issue or things that they want to deal with like that?
Yeah, well, I'm glad you brought up the training. I think it's important for people to know that the level of training that pharmacists get when it comes to things like ethics and confidentiality and privacy is no different than what a nurse gets, what a family doctor gets, and so on and so forth. We are bound by the exact same privacy legislation and ethical training and application as any other healthcare provider. And so it is a retail space. And so some people kind of forget that and then aren't really sure about what kind of training does that professional staff over there in the dispensary actually have. But it's the exact same as if you walked into your psychologist's or psychiatrist's office, your family doctor's office, a nurse practitioner or nurse's office. And so I think as long as people are aware of that, then they may say, all right, in this private space, I am going to share this information with you. And what you say to your doctor, now you're going to keep this to yourself, aren't you? Like you wouldn't say that. But with a pharmacist, if you don't have that relationship yet, you might still be a little bit uncertain. But I just want to reassure people that a pharmacist is bound by the same regulations as any other healthcare provider when it comes to privacy and ethics.
Well, thank you for that. I think that that's so important, and it's important for people to understand that the same way that when they dispense your medicine, they don't tell everybody around you what it is that you're taking. So that's the importance of that confidential relationship. It's essential. And in the Bloom program that you've done, it's been across parts of Nova Scotia. Has it been successful? What actually has it done in the province?
So in Nova Scotia, it started as a pilot project, probably 5 to 6 years ago. And when that was finished, we had to do an evaluation and deliver the results to government and at the same time to the health authority across the province. And that was one of the most nervous days of my life. Basically, I was going to find out whether or not there was a thumb up or a thumb down. And by the end of that day, I was, cloud nine kind of living. I just thought this was the most amazing thing, because it seemed like there was interest there. And then as, bureaucracy steps in, everything slowed down. So we had a couple of good years of building the program up. And then when COVID came along, this is where we learned a lot about the program itself. There were so many new priorities that came along with the pandemic. What's going to happen to this program that really now is part of the budget of the Nova Scotia government, because they've had to reallocate things and so forth. And the program continues to grow, and the Department of Health and Wellness, the government of Nova Scotia, continues to see value in the program itself. So I think when we were finished its evaluation, we had close to 30 pharmacies. There are over 300 pharmacies, and I just want to add a stat while it's in my head. I think it's something like 85% of Canadians live within 5 kilometers of a pharmacy. Wow. So pharmacies are sort of strategically placed across the country for quick and easy access. So in Nova Scotia, we have 300 plus pharmacies, and now we have, I think, somewhere between 50 and 60 pharmacies that are bona fide, certified pharmacies offering the Bloom program. They had to go through a lot of steps to become sort of approved to offer the program. Mm-hmm. And then when people come into the program, they're actually enrolled in the program. There's a process for each individual patient to be enrolled in the program itself. So the program is growing, and we did a survey of our pharmacists, maybe about a year and a bit ago, to find out how they're doing with the program while the pandemic is the priority. And we learned a lot of interesting things. One is they felt that they were better prepared to support people with their mental health because they've been offering the program. And it's not just the patients that go into the program, but it's everybody. So
Right.
during the pandemic, there's been a lot of talk about people's mental health. And the pharmacists felt much better prepared to support people who had questions about that, and resources and places to refer them to and so forth. So that's a big part of the spin-off benefits of having a program such as the Bloom program. And I think we're learning that sometimes bringing people into the Bloom program does get pushed off to the side, because you've got to get a lot of vaccinations into an awful lot of arms, and it's hard to do two or three things at the exact same time. We understand that, and we're not expecting things to always be the same in terms of access, but it's really reassuring to know that the pharmacies who've been offering it have said that they think of it as a priority, especially during the Bloom program, and they see of themselves as being really integral in primary care because of the Bloom program and COVID all coming together at the same time.
Wow, that's really, really interesting to know. I didn't know about that, and that certainly shows how valuable this kind of intervention is, because the COVID has tested all aspects of our healthcare system. But it seems from what I hear you saying is that although the COVID was really, and clearly with the vaccines and everything, testing the capacity for pharmacists to deliver the care, this still was able to continue, and actually met an even potentially greater need because of people coming in and whatever they were feeling during that time.
Absolutely.
So,
yeah.
Go ahead.
Well, I was just going to say, and I don't know if it would have grown faster had we not had the pandemic. Quite possibly it would have, but even just to note that it continues to get the numbers higher and higher, with more pharmacies coming on every 6 to 12 months.
Well, clearly is filling a need, and that's so important, because the pharmacy is already there. It's not like you have to build a whole new expensive infrastructure. You're utilizing things that are already on the ground and in the community, and people get to know the pharmacy in the community. I know the pharmacists where I go. You probably do too. So you're avoiding a huge upfront new cost with that, and you've already got really well trained healthcare providers, and you're just tweaking their training, and off you go. So that's a potentially quite a frugal way to approach this whole issue.
Exactly, and the bricks and mortar are there, and that's right on the nose, Stan. And the other part that's kind of sneaky is when somebody gets enrolled in the program, the default period of time is 6 months to help them identify what are their priorities in terms of their health and their medications. And when it comes to psychiatric medications, we don't fix things overnight. We don't find the combination or the individual medication that's perfect for that individual. We don't solve the difficulties of adverse effects that come along with taking these medications, and sometimes stopping them can be quite a challenge as well. That doesn't happen overnight. But when your 6 months is up, we talk about graduation from the program. Hopefully we've addressed your primary issues, and that you're moving forward and into a good place, and you don't need to be in the program anymore. But guess what? You just keep coming back to the pharmacy anyway, and the pharmacist, and the pharmacist knows you, but they know you so much better, and you've now interacted with that pharmacist probably in a different way than you did before. But that will continue. That past 6 months will continue to benefit the next 6 months and the following 6 months, and so forth.
Yeah, you've added not just only a unique input, but you've also added an additional human connection, which is so important to people. And which, the other issue that comes up here, and I know that you and Andrea Murphy have done work on this issue as well, is issue of suicide prevention and the potential role of pharmacists in suicide prevention. They're seeing people on an ongoing basis. They get to know them, like you said. They also know what medications they're on, and they know which medicines may be more dangerous than others. And if I remember correctly, a large number of suicide attempts in Canada are driven by medicines people take. So what about that? What about the role of the pharmacist in suicide prevention?
Yeah, so Andrea and I have been working in that area for quite a long time, and I think we've connected with you in the past on this area as well. And so the number in terms of serious suicide attempts leading to hospitalizations So this is not the actual overall number of suicide attempts. It's much larger than that because only a minority of them lead to hospitalizations themselves. But if they do lead to hospitalizations, 86% of them are from self-poisonings. So the vast majority of those self-poisonings are from medicines in your cabinet that you purchased at the pharmacy.
Right.
And so if we just sort of step back and think about that, there's going to be a lot of self-poisonings that don't actually lead to hospitalization. You may go to the emergency room, you may go to a walk-in clinic, or nobody else ever actually knows about it. There's lots of that going on. What we're really concerned with is one serious overdose increases your risk for a future serious overdose, which together, all of them together, increase your risk of suicide-related death. And so if you are going into a pharmacy and getting prescription medications or over-the-counter medications, and you have a relationship with the pharmacist, that pharmacist knows you on good days, knows you on bad days. They're able to detect when you're feeling a little bit off. Now, suicide itself is really, really unpredictable. It's really difficult to identify. But if you have had a serious suicide attempt in your past, it's probably really good for the pharmacist to be aware of that. It's probably really good for you to actually have a chat with your pharmacist about this. This is for your own well-being, for having that pharmacist who is there to see you when you're not having the best day, and to be able to talk to that pharmacist, especially in that private space. And for the pharmacist to maybe be able to pick up on cues to see if you're not feeling so well. So there's the clinician in the pharmacist, that clinical role that the pharmacist fills. And I think that's something that we really haven't thought of strategically when we're thinking of a regional plan for reducing suicide risk. And then the other part of it is the pharmacy is the source of toxins itself. So you've got a clinician there who can help you with your mental health. And if you have had a serious suicide attempt in the past, or if you have a psychiatric illness where the risk is increased, that pharmacist is there to support you. But there's also something maybe just in that self-selection part of the pharmacy that we can do differently than we've done. So other parts of the world have tried different things. So package size of medications that are often used in overdose attempts have been reduced in some countries. And some of the data indicates that that may be part of an overall plan to reduce overall overdose-related deaths. Now, the data is not crystal clear on that, and some people say it's good enough for me, and other people say I need more data on that. But some of the things that we've talked about is, should we be thinking about just reconfiguring the pharmacy in and of itself, where you go to the cash register, so to speak? Can there be something that says, hey, we would like, before you make this sale, this purchase, you to go to chat with the pharmacist? So there's a variety of different things that pharmacists probably should be connecting with patients on, in part to avoid that risk with medications themselves, but more importantly, to make that clinical connection with the individual and just say, how are you doing today? How have you been sleeping over the last little while? A couple of open-ended questions can lead to some really interesting discussions. And if you give me a second here, Stan, I've got a couple of quotes that might help people really see what I'm talking about. Is that all right?
Yeah, right.
So they're with me. And this is from a survey we did in Canada and Australia. We had 400 pharmacists participate in this to really get an idea of what their experiences have been working with people who are at risk of suicide themselves. So here's the first one. The pharmacist said, the patient presented to the pharmacy with a prescription for an antidepressant after being seen at outpatients. He was extremely emotional, crying and sobbing. He was brought to the private counseling room in the pharmacy, where he expressed his concern and stated that he didn't know how much longer he can live. So this is something that pharmacists on a regular basis, interact with patients about. And the second one is, patient came in for a blood pressure check. Upon discussion, he mentioned that he'd taken 24 tablets of a medication to commit suicide. We kept him in the pharmacy and contacted a psychiatrist and GP, and they were both busy at the time or weren't quick enough to answer the phone. So we then contacted the ambulance, and he was able to get in touch with a colleague to come to the pharmacy and stay with him until the ambulance arrived.
Yeah.
So not the kind of thing that I think most people recognize from a public perspective, and maybe even other healthcare providers are aware that this happens in pharmacies.
Well, here's a resource that's sort of hitting us in the face. We don't even realize it, and how so important. And you say it so well. There's one other thing that just occurs to me here is that we know that one of the most challenging periods of increased risk for death from suicide is upon discharge from an inpatient unit in a hospital.
Yeah.
And typically what happens is that the person has a medicine or more than one medicine that they're taking. They have to go to the pharmacist to get the medicines filled. To me, that seems like just an obvious thing. If the hospital or the physician is communicating that to the pharmacist, I would think there has to be some kind of active communication channel, because that's one of the biggest risk periods. What are your thoughts on that?
Yeah, the term dog's breakfast comes to mind when it comes to that. I think of the discharge planning and the continuity of care. It can be set up perfectly. So, the discharge prescription really needs to be thought out very carefully. What is really needed to be on this prescription? Because sometimes there's carryover effect from inpatient medications. So cleaning that all up before the person leaves with the medication and goes to the pharmacy. And then the really key information is, when are you going to be seen by your physician, your healthcare provider, the primary person who is really quarterbacking your care after this mental health inpatient stay? And sometimes it's tomorrow or the next day, and you're filling a prescription with a relatively small number of days of medications. And everybody feels good about that. But then in other cases, it's very different. The medications themselves don't align with the ideal. So the prescription's a little bit off, and the pharmacist has to reconcile the prescription. And the follow-up period is unclear. It's not even clear to the person who's been discharged when they will be seen. They're going to find that out in the future. Maybe in a couple of days it'll be clarified, or maybe it'll take a couple of weeks. So the pharmacist truly is left holding the bag until that actually happens. So as pharmacists, very often it's, okay, so you're a bit in limbo. What I want you to know is, I'm here for you. I'm going to give you 7 days worth of your medication now, and I want you to come back in 7 days, and so I can know what your plan is thereafter. Did you contact and be seen already? Are you going to be seen in another week or so? So let's make sure we stay in contact. One thing that we do need to separate is the dispensing period of medications from the ideal follow-up time of the pharmacist. Some people say, well, I only talk to my pharmacist when I need to get my medications. And that's why sometimes pharmacists will say, I'll give you a certain period of time so that we make sure that we see each other in that right period of time. But it may be that, well, I'll give you 2 weeks of medication, but I need to talk to you in 2 days. I need to talk to you in 2 days because you're going to take a medication that might cause you to have certain side effects that will make you not like me, not like your prescriber, and not like this medicine. And I can help you get through some of those things.
Well, it's important to say, and then harkening back on the work that you and I have done previously, the side effects come before the therapeutic effect. And it's the really important part of this relationship is to be in touch with people throughout the process, not just 2 or 3 weeks later. I mean, it's really important, and the pharmacists can play a really important role in there. Look, it's unbelievable. Our time is coming to an end, and like in 30 seconds, can you give us a bon mot or something like that takeaway? What would you say as a takeaway?
I'll try and give you a little sweetie before you go. The circle of care is a term that people use to talk about who do you share your most personal healthcare information with. And do you think of the pharmacist as inside the circle of care or outside of the circle of care? And sometimes that's hard to know when you don't have a lot of knowledge about the pharmacist and trust. And I would like to ask people to think about them as in the circle of care and take full advantage of the pharmacist patient relationship and that collaborative relationship with the other healthcare members of the team. So everybody's plan is aligned.
That's excellent. The really clear, concise, and circle of care, incredibly important concept. So look, I want to thank you, David, for taking the time out of your busy day to share your ideas, your thoughts, and you're successful. This is a successful approach. And if people want more information, they can contact you directly, David Gardner, Dr. David Gardner at Dalhousie University. And next session, we're having Dr. Mel Wyman from British Columbia. We're going coast to coast to coast here. And she will be talking to us about Indigenous-led initiatives in mental health care and primary care. So those of you who are with us right now might want to tune in and hear what Dr. Wyman has to say as well. Once again, thank you very much, David. Take care. All the best.
Bye-bye.
Bye now.